ladies and gentlemen. My name is Vance. I'm the general manager at Armstrong, and I've had the pleasure to be joined today by Dr. Greg Elkins of Lincoln Primary Care Center in Southern West Virginia Health Systems. And we're coming today to kind of talk about this whole COVID vaccine. You know, we're trying to dispel maybe some of the myths and rumors and get some facts. So, Dr. Greg, first, thank you for joining us today. Appreciate it. Appreciate your time. So, give us some facts about COVID, what we're seeing. You know, you hear all these numbers, like who's getting it now? What's the actual truth of the number of people that are getting it?
Well, Brian, the real numbers now are showing that this is predominantly a pandemic of the unvaccinated. 95% of the folks that are getting COVID-19 now are unvaccinated, and 98% of the hospitalizations are in unvaccinated people. So that's exactly what's going on today. We've done a pretty good job in our vulnerable elderly here in West Virginia, across the country, and even here in Lincoln County, getting the 65 plus year olds vaccinated. A decent job at 50 plus, but we fall off a great deal in our vaccine numbers after you get below that. So that's an area that we need to focus on, particularly as it's now early August, we're getting ready to go back to school, and we've got eligibility for vaccine now for our 12 to 18 year olds, but we've just not seen quite the number of kids in that age group that get vaccinated that we'd hope to.
Well, some of the things else that I've heard while being out and about a little bit, and people aren't worried because, well, I'm young, I don't have to worry about it. I think that's a myth that we're starting to see, that yes, even if you are younger, you can still have some dire effects from it.
Exactly, and I think that's kind of carryover from our initial messaging with COVID, because with the early parts of the pandemic, what we saw was that young people, kids from 0 to 18, were not as susceptible to the predominant strains, but the newer variants have a proclivity for that age group. They really attack those young people a whole lot more. They're a whole lot easier to get, and the kids get a whole lot sicker with them than they did with the original variant. So, you know, we've seen people that got the message early, but when we've changed our message, which has been difficult during the pandemic, because as we've seen the data change, we've had to change our messages. That sometimes brings some doubt into people's minds, but it's really how science works. We change our message as the science progresses, and we get better data. I've always said we're better off to raise the hood on the car before we decide that we need new spark plugs. Now, those of you that know me know that I don't know anything about what happens when we raise the hood of the car, but that's an analogy that I've heard works.
Well, I'll tell the viewers that's watching this now, that's one of the reasons we decided to do this. And I told Dr. Greg early on, you know, I don't ask him to come fix my internet or cable because, well, you know, I've got more expertise than that does. But when it came to this vaccine, he's my expert. This is the guy that I wanted to come to because, you know, you're in the medical field, you definitely have your doctor, but you've done a lot of research, which is the reason I came to you. And as I told everybody, and I can tell you viewers now, one of the great things he said was, I'm rolling up my sleeve. So I can tell you that I've been vaccinated, my wife has been vaccinated, 2 of my daughters have been vaccinated, and the only reason the third one has not is because she is 11 years old and they haven't approved that yet. But I think it is interesting. It's something that I would like you to tell the viewers. Everybody kept hearing, I've heard this vaccine is new. Well, that's not entirely true.
That's a real good point. The technology behind the vaccine hadn't been used in a vaccine that we'd rolled out to patients before, but the mRNA vaccines have been in the works for 20 plus years with earlier versions of coronaviruses, which is what the COVID-19 virus is. And so the technology's been there, and actually the truth about how quick this vaccine was developed is it really was developed fast because that technology was on the shelf ready to go. Once they were able to do the science behind the gene sequencing, the real work in developing the virus only took a few days, to be honest.
Really?
Yeah, it was actually pretty much over a weekend. the other thing is people say, oh, it's not fully approved, it's emergency use authorization, and that's true right now, just because we don't have the long-term data. Here's the truth about vaccines and vaccine safety, though. Bad outcomes with vaccines happen invariably in the first 30 days after the vaccine, and almost always within the first 48 hours. So we've really, what we've seen is when we look at the safety data with these vaccines, they're pretty doggone safe. And they're safer by far than getting the coronavirus, than getting COVID-19.
Yeah, absolutely. I think we talked earlier that you've had some discussions with other doctors, for people that were unvaccinated and did have some serious effects, and they're in a hospital, and the first thing they're saying is, "Can I get the vaccine?" Well, at that point, it's too late. You can't give them the vaccine when they have it that bad.
You can't give it to them when they have it, but one of the things that we've seen just in the last week, they've started to come out with some studies that show that patients who've had COVID-19 and have subsequently been vaccinated afterward have much greater immunity than those that had COVID-19 and didn't get vaccinated after the fact of having the illness. So the safety data again shows, even if you had COVID and you haven't been vaccinated, you should strongly consider it, because the safety data is there that shows you're going to do better.
And another thing I'd like to tell the viewers, try to describe, because we've all heard the Delta variant, the British variant, the different variants. A lot of people don't know what that actually means. What is a variant? How does a variant come about? You have COVID-19. How is there a different type of that? Can you explain some of that?
It evolves itself, but it's not like flu. Flu, we have a different strain every year, or two different strains. So the flu shots incorporate the different strains. With the COVID-19 vaccines, they're a vaccine against this thing called a stalk protein, S-T-A-L-K. I know Southern West Virginia speak. I'm not always going to hear what I have to say, but it's against that particular protein, and that protein stayed the same from variant to variant to variant. Now, yes, the data shows that the vaccines are not quite as effective against this newer Delta variant and the Delta Plus variants that we're seeing, but they're still far better vaccines than what we have every year with our annual flu vaccines. And people run out to get those. So I think it's, again, we need to be sure we've got the right information.
Yes.
To make the best decisions.
Well, the one thing, and I can tell you folks, that's another thing I want to talk to you about. We heard all this stuff about it, and it's rumors on the street. You don't know what it's going to do, the side effects. And I've joked, folks, I've had it for quite some time, and I don't have a third arm or anything like that yet. And I joked, I said, how come every time you hear a side effect, it's always bad? Maybe it's a good side effect that you have. But so far, in limit, are we hearing anything as far as massive side effects of the vaccine?
Well, I think we've all seen some of those reports on the Johnson & Johnson vaccine and some of the blood clotting and those kind of things. But again, if you look at those numbers and compare those numbers, the folks who got those vaccines were at just about the same risk of having a car wreck on the way home from getting the vaccine as they were from developing the side effects of the vaccine. So, and I don't want to make light of side effects, because everything we do is going to have side effects.
Yes.
Every medicine that we take is going to have a side effect. All of our activities in life are about risk and reward ratios, and if we weren't willing to accept some risk, we'd all just end up sitting at home all the time, rather than getting out and doing things, or driving down the street, or going to the store, or whatever. So, we have to look at that. But we really, these have been among the safest vaccines that we've ever seen in the history of the world as well.
And we're seeing a pretty good sample size, because it is not just the United States. This is a worldwide pandemic.
Absolutely.
So we're getting a lot of data coming in.
A lot of data coming in, and that's what we need to be using to make our decisions. Is this data as the data gets better, and I think we're doing that. And all in all, we haven't done bad. We just like to encourage folks to look at the data a little bit closer if they haven't been vaccinated, so that they can make the best decisions for themselves, their families, etc.
Well, and like I told the viewers here, I came to you because, like I told you, he was my expert. But also for me, I'm going to say this, since being vaccinated, my family being vaccinated, maybe a little bit of anxiety issues that I don't have anymore. It's an ease of mind that we're good now. We're going to be taken care of. Yes, it's 95% effective. That means there's a 5% chance that we could still get COVID. And we understand that. But from what I understand, this side effect, the symptoms of that have been milder if you've got.
That's been typically the case. We've seen less severe disease for most of the people that have been what we call breakthrough cases. And, it's not the case in 100% of folks, but for most. Now, the one thing about the percentages is it actually doesn't mean that you still have a 5% chance of getting COVID. Those numbers are in comparison to unvaccinated people. You have 95% less likelihood of getting it than if you
were unvaccinated.
And you still don't have, if you or I had COVID and neither one of us had been vaccinated, and we were coughing on each other, the percentage still wouldn't be 100% that you'd get it or I'd get it from the other person. So those numbers are even better than those 95% numbers.
And that's what I think, and that's why for folks, if you get a chance to watch what we're doing now, you're watching it now. We've heard so much, the viewers have. It was, the mask, and then it was double mask, and then it was, well, you can still pop negative, or you can be a positive. There was so much, I think, confusion, which is why we wanted to come to you today to say, let's just talk the facts of this out right now.
Mm-hmm. Well, and like we were talking about before, I think that the medical community has tried to change the messaging as we've gone, and that's hard. In our culture today, we look for an answer today.
Yeah.
We live in this internet-based world of information where people don't read a morning newspaper to get their news. They don't even watch TV for the nightly news to get their news. They go on the internet to get their news 2 minutes after something happened, and sometimes 2 minutes before it happened.
Yeah, exactly.
And that messaging, science doesn't work that way.
Yeah.
We have to collect data. We have to assimilate that data, and then we have to analyze the data in order to make the best predictions that we can to keep folks safe. And I think we've tried to do that, but because the data has come in, over time, some of that information has led us to change our opinions about the best prevention, the best treatment, etc. So the message has changed, and that's hard sometimes for the public to understand why did we change that messaging. And the best analogy for that I've got is, and I went to medical school some years ago, and in that time period that I was in medical school, we changed how we told people to lay the baby at night to sleep.
Yep.
And we adapted. A few years ago, we learned that we would be better off instead of covering our mouth when we had H1N1 flu. Mm-hmm. We learned instead of covering our mouth with our hand when we coughed, to cough into our elbow, and we adapted. We've learned. One of my cousins was talking about one of his grandchildren the other day, and we were talking about what happens when they go back to school. And he said, well, he's never gone to school without a mask.
Yeah.
So if we have to do that this fall, then we have to do that this fall. I hope we don't have to do that long term. Mm-hmm. But I think we need to adapt to the best messaging that we have out there. I'll take a different step and say, I think we have to look at other consequences as well. It's not just all about the absolute medical thing. We have to look at what happens with our social distancing, what happens with our kids who aren't assimilating in schools. And we have to make the best decisions overall for the kids and for the populace.
Well, that's one thing I'm glad you're talking about, the messaging, because, at one time, everyone was sure the world was flat. But we learned, and we've changed that to what we know today. So I think the same thing and you may hear this, I'm not saying to the viewers that we know this for sure, but a year from now, we may learn something new and change the messaging again.
I suspect a week from now, we're going to learn something new and change the messaging. It's just part of what science is like and how we have to adapt. I think we make the best decisions we can based on the best information that we have in front of us.
And that's what I think. And I can tell you, folks, you are vaccinated, I am vaccinated. We have a bunch of folks, like you said, West Virginia has done pretty well in a certain age group. And I think we're doing this to maybe give facts to everyone and to the groups that are younger like that. Please talk to your local your doctor to see if they know your body well. If they think it's safe, guys, let's get rid of this thing as quickly as we can. I know same as you and as everyone else, I put these masks on and you adapt and overcome them, but I like it a lot better without them.
I like it a lot better without them. Unfortunately, I have a face that's made for a mask, so a lot of people prefer to see me with a mask on. And you may see us in healthcare for quite some time continue to see patients with masks. It wouldn't surprise me at all if you have respiratory illness, if we don't go from this point forward wearing masks to take care of patients. Probably a smarter thing to do than we've done before.
Yeah, and it's something you adapt to.
We learn as we go.
Absolutely.
We learn as we go.
I think we say as you grow up, that wisdom comes around as the older you get, and it's the same thing. The more we learn, the wiser I think the whole medical profession.
And there are a lot of things that we had available to us that we didn't necessarily use. And I'll use, we're sitting here in the Grace Ann Dorney Pulmonary Rehab area here at Lincoln Primary Care, and Grace Ann is a lady who helped us get this program started. And I learned years ago from Grace Ann that it's safer not to shake hands. It's safer
to do
that.
And it is. It is much safer, and it's just something that we can, over time, I think we'll adapt and things will change and we'll all be safer for it. I do believe so. So if I'm watching this now, and maybe I am unvaccinated, I said, I think I want to do that. How would they go about? Can they still come to the...
Well, the best thing that they can do is they can either call the closest of our offices to them and we'll help them get facilitated onto a list, or they can still go to the state hotline, just go on the internet and go to, I don't have that internet address in front of me right now, but go to West Virginia COVID DHHR, look that up on Google, and that'll drop you into that page and it'll link you to that. That would be the best thing, the two best avenues. Or contact the health department.
And then like before, earlier in the spring, when there's some worry about how many, we have plenty of them.
There's plenty of vaccine availability. And again, back early in the spring, our 12 to 18-year-olds weren't eligible. They're eligible now. And as we get ready to go back into school, that now's a good time to go ahead and get started.
Get it out of the way.
Get it out of the way. And, get that first shot before school started so that you don't have a downtime, of feeling bad for a day.
Yeah.
But remember, feeling bad for a day 2 times is better than having COVID and being in the hospital.
Well, I've told folks, the Lord has blessed me. The first one, I didn't even hardly notice anything. And then on the second one that I got, we actually went to Home Depot that evening. I came home and told my wife, she said, "How you feeling?" I said, "Just a little tired," but I thought it was from the day. And she was like, "You probably, are feeling some effects." So I thought, the next day could be awful. The next night, we actually filmed the basketball game out here at the gym, and I felt great. So, my effects were very, very mild from that. So, no problems whatsoever from anything that me or my family, from the vaccine, from the shots. Maybe like you said, a 12-hour period, my wife a little tired, but other than that, smooth sailing.
Yeah. So, we've seen people that have had a little bit more rocky road than that, and we've seen a couple of people that have been folks that have had COVID and then been vaccinated, And because they'd already had some immune response to the natural disease, their immune system was ready and just kicked them pretty good when they got the vaccine. But to the person, what I've heard from them was, I felt bad then, but I didn't feel near as bad then as I did when I had COVID.
Yeah. Yeah, you hear that to a person that they're saying that.
To the person. Again, our person to person, we make a lot of decisions that way. It's anecdotal, but that's what we're hearing from the big numbers.
Well, I think it's interesting to tell people, and when I used to start to describe this to people, the symptoms are actually your body fighting the disease. I mean, it's not really, say, the disease itself. It's your immune response against that makes you feel bad. Mm-hmm. That's what the whole problem is. I joked with someone before, said, so would you be worried about it if you had no symptoms whatsoever? Like you didn't feel bad? Like, well, no. So that's your immune response. That's the reason we do this, because your immune response can sometimes overwhelm your body. And we've heard something, I'm sure everyone watching this has probably heard stories of people. They may have lost a loved one. They may have had something happen. And as terrible as that is, you might see another person like that has no response whatsoever. Oh, I felt great. That's the crazy thing about this disease. It affects different people in different ways.
Yeah, and it really does. And again, the big thing with vaccine now, with the variants and where we are, is that we're seeing people have less symptoms. We've seen several people that have just decided, because they had a little sniffle after they had an exposure and they were vaccinated, test positive now, where probably 6 months ago they never got the test.
Yeah.
So that's kind of where that stands.
Well, Doc, listen, I appreciate your time. Thank you very much. I hope everyone watching this, what we try to do here is kind of a public service announcement. And we appreciate Dr. Greg and all the folks here at Lincoln Primary Care Center doing so much they can. We just wanted to give you the facts out there to try to let you make your own decision. But we do, the folks here at Armstrong also want to recommend visit your local physician, talk to them about it if you've been unvaccinated, and talk to your local medical professional and see what they think about it. And let's eradicate this as quickly as we can.
Thanks, Brian.
Thank you.